Hi, I'm Stacy Cropley, and I've been a pediatric nurse for quite some time now. I became a pediatric nurse after doing several rotations in my nursing school program, and one of my instructors noted that I just had a particular affinity with children. They were drawn to me, I was drawn to them. I really enjoyed the care that I was able to give to them, and I was able to make their healthcare experiences better than what they had experienced before. And so I kind of dove in with both feet into pediatric nursing.
I became a pediatric nurse practitioner simply because I needed a definite change in my in my career path, and I also definitely like the independence along with the role. I went to a primary care office just so that I had that independence.
I think one of the reasons that I became a pediatric nurse practitioner was the fact that I really wanted to spend more than just that 8-hour, 10-hour shift taking care of a child who would then be discharged maybe a day or so later. I wanted to see children grow up. I wanted to see them go through all the stages of being an infant to a toddler and into the teenage years, and that was quite exciting for me in working with families.
I just found a real empathy with working with kids, and I just loved working with children from the get-go. They are just such special people. They don't act like adults do. When an adult is sick, they act sick, and kids, they just kind of keep on going. If they're really sick, it makes a difference. But like I said, for the most part, they're very resilient and do a lot of things.
The first year that I was a pediatric nurse, I think the most surprising thing to me was how resilient children really are. While they get sick a lot faster than adults do, they also have this resiliency and this drive and this will to get better and to get out of the hospital setting, and I think that's always been a positive point for me in working with the pediatric population.
Basically, you're not expected to know everything. The important thing is knowing when you don't know something and then being able to go to somebody else that has more knowledge, or knowing to look it up in a book. And it's okay to tell a client and their family that I don't know this.
I think children know more than we give them credit for. One of the groups of children and families that I always like to work with, and has always been a love of mine, is working with families where the child is dying, working with the siblings, working with the parents. And I found that children are beyond their chronological years. They're just amazing. They're far smarter than we give them credit for.
I've been a nurse practitioner since 1977, so for a really long time. And I'm really glad that I chose this line of work. I love being a nurse, and this has given me the opportunity to work with children in a variety of settings. Over the years I've done primary care setting, I've done public health, and then now I'm working in an inpatient children's hospital setting. So I found a lot of room to grow and a lot of different opportunities to learn from. I would recommend it to anybody.
Being a pediatric nurse practitioner and a pediatric nurse, I mean, there's nothing like it. There's nothing like seeing that smile on that child, or getting that hug from that child, or having them draw you a picture. Recently had a patient who received a heart transplant, and she wanted to draw me a picture, and she drew a picture of a heart and her love, and she immediately drew an outline, and it ended up being her new heart. She said, "This is my new heart, and this is what it looks like."
Nursing is basically a growth industry. There are a lot of people that are getting older, myself included. So eventually I'm not going to be working, and a lot of the other baby boomers won't be working, so there's a lot of room to expand in nursing. And it's really rewarding to be able to help other people, even if somebody is terminal, to be able to help them do the best that they can. I worked in home care for a number of years, so being able to help children stay at home with their families so that they can be a part of that family unit was very important versus just living their life out in a hospital.
I also think that one of the rewards of being a pediatric nurse, and especially working with students in my faculty position, is seeing that aha moment. When you work with children, you cannot be task oriented. You have to roll with the punches and just kind of go with the flow, or as they say, or go with what's going on with that child that day. There's nothing set in stone.
If I were to encourage anyone to join the nursing profession, I would say that your skills, your hearts are needed, especially when it comes to children. Children are our future, and we need to handle them with care and with love, and we need to give them a good feeling about what it means to be healthy and what it means to be invested in being an advocate for health and wellness. So I would definitely encourage our future generation of nurses to come on in and join us.